myself, Tafsir Ony, one of the co-founder of Sustho XYZ, and also the fellow member of Global Changemaker Fellow of Connecting Dreams Foundation. So today we have gathered some of the brightest minds and dedicated experts in the field to address the pressing issues that affect the health and well-being of our rural communities. So let me introduce with all of our panel members, Mr. Rafiq Islam, co-founder and CEO of Safewheel Bangladesh, Itumeleng Likhama, who is an aspiring writer and a mental health worker, and she also runs a podcast to promote mental health awareness. We have Proloy Chandra, who is the co-founder and CEO of Sustho XYZ. I'm really sorry that we have missed one of our guests, who is Moklisur R. Mijba, whose father-in-law has passed away, so we couldn't get him tonight. So, rural areas face unique challenges when it comes to accessing quality healthcare. So, I think this panels aims to shed light on these challenges. We'll have focus on the mainly what issues are happening on every side, and also through our discussion today, we'll endeavor to dissect these challenges, understand the root cause, and brainstorm effective strategies to overcome them. We'll also explore technology, telemedicine, mobile health apps, and electronic health records, if that are any close and can be helped to save up rural health people, right? Our panelists will share their knowledge, engagement in education, emphasizing the importance of empowering individuals with knowledge that can transfer with health outcomes. We'll also talk about mental health. I think Itumeleng can help us on that because we always see focus on the city side but not focus on the village side. So we'll explore the unique challenges rural people face about mental health issues. I encourage our panelists to share their expertise, experience, insights, and innovative ideas openly and broadly. So everyone, thank you for joining in our conversation. So before I give the floor to our panelists, I want to thank you, the Changemaker Summit organizers, for organizing this such a beautiful panel and give this floor. So first I will go to Mr. Rafiq Islam. Can you tell me about yourself, a little bit your background, and how you started Safewheel? What comes the idea?
My name is Rafiq. I am from Bangladesh, and I am a founder and CEO of Safewheel. We started Safewheel as an ambulance providing company to the rural population of Bangladesh, and then gradually we pivoted our business model into now being an online pharmacy, delivering medicines and other healthcare essentials, and also selling online diagnostic test service and telemedicines. We started our business from a competition. It's called Hall Prize. It's at the ending time of our university. Me and my two other friends started this, and then first 2 years we built a tricycle ambulance business in the rural part of Bangladesh, and now we are doing telemeds and other digital health. So that's about me and my company. The company name is Safewheel. That's Afewheel.
Thank you so much for the beautiful introduction. Itumeleng Likhama, can you get to know about yourself, what you are working, what is your background, and why you are working on this sector? How your initiative helping the rural communities?
Okay, thank you so much. Nice meeting all of you. Good evening, esteemed panelists and respected audience members. I'd like to start first by appreciating the significance of this moment. I feel extremely honored to be here, especially to talk about a cause that is very close to my heart, which is, promoting mental health through the lens of self-love. So my name is Itumeleng Likhama. I am from Lesotho. I run and manage a Facebook page that promotes mental health through the lens of self-love. I also have a website on WordPress that I run and manage as well. And I also have a podcast on Spotify. So self-esteem, self-worth, mental health, self-love, and everything are very, very, very important to me. So in the context of our discussion on rural healthcare realities, I think it is imperative before we do anything else to acknowledge the significant challenges faced by our rural communities. So these challenges range from limited access to medical facilities, a shortage of healthcare professionals, to the pervasive lack of awareness about mental health issues. So people in rural areas really, really, really struggle with mental health issues because, first of all, they may not be aware of it because of limited resources and limited access to information. So allow me to paint a vivid picture for you, a picture that portrays the stark reality of rural health scenarios. In many of our rural areas, residents must travel considerable distances to access even basic medical care, and the dearth of mental health resources is even more pronounced. Yet amidst these challenges, there exists a beacon of hope, the profound impact of self-love on mental well-being. Self-love acts as a resilient foundation upon which individuals can build their emotional strength and navigate life's complexities. Imagine for a moment a rural resident embracing self-love, a transformative practice that encourages individuals to value their own worth, embrace their strengths, and cultivate a positive relationship with themselves. By fostering self-love, we empower individuals to counteract the toll that isolation, limited resources, and societal pressures can take on their mental health. As we delve into solutions, we cannot overlook the revolutionary potential of telemedicine and other innovative approaches. Telemedicine bridges geographical divides, bringing medical and mental health support directly to the doorstep of our rural communities. Consider this, with a simple video call, a rural resident can connect with a mental health professional, access counseling, and receive the support they need. It's these indigenous solutions that hold the promise of transforming rural healthcare landscapes and making mental health assistance a reality for all, regardless of their location. While telemedicine is a vital step forward, staying motivated and mentally strong in challenging circumstances requires a comprehensive approach. Residents of rural areas can draw inspiration from their own resilience and the tight-knit communities they belong to, because I'm sure we can all agree that residents in rural areas still very much appreciate like, allow me to use a South African, or to borrow a South African that term that says Ubuntu, but they have that sense of togetherness, that tight, close-knit communities. So those close-knit communities could really help them or inspire them to cultivate resilience. So by fostering a sense of belonging, nurturing social connections, and providing platforms for open dialogue, we create an environment where individuals can share their burdens, exchange coping strategies, and collectively navigate adversity. In conclusion, ladies and gentlemen, the path toward wellness in the countryside is multifaceted. It involves addressing the gaps in healthcare accessibility through innovation solutions like telemedicine, while simultaneously fostering a culture of self-love and mental resilience. As we continue this important dialogue, let us remain steadfast in our commitment to empowering rural communities, nurturing mental well-being, and ensuring that every individual, regardless of their location, can access the support they deserve. I extend my heartfelt gratitude to my
Thank
fellow
you,
panelists,
Itumeleng. I'm
the
sure
organizers,
many
and
lives are
each
changing
and every
in
one
your
of you for your
initiatives.
invaluable contribution to this discussion.
Let's
Thank you.
your turn, Proloy Chandra. Tell me about yourself, your some background, and how you came up with this idea, and where you're working currently.
Okay, so I'm Proloy Chandra. I'm co-founder and CEO of Sustho XYZ. So basically, our motto is modernizing rural healthcare system. So basically, in this area, we don't need to go to the doctor if we face any kind of health issue. We can easily consult with the doctor from our home using different kind of telemedicine services. There are so much telemedicine services in our city now. But what about the village people? What about the rural area? they don't have the smartphones also. Almost 10 to 15% people from the village have only the smartphone, and rest of the people don't have the smartphone. They have the button phone actually. So how can they easily use the telemedicine services from their villages? So basically we came up with an idea that why don't we set a point. So actually we called it Sustho patient point. So what is Sustho patient point? We basically targeted that pharmacy, the local pharmacy of a village. Basically, when a people of a village feel some kind of sickness or something, they usually go to their nearest pharmacy. So we make this pharmacy to a digital, you can say digital doctor chamber. So suppose a village people is suffering from some kind of fever, so that he will go to the pharmacy and tell his all kind of problem. So the pharmacy man or the pharmacy owner will make a video call for him to our Sustho XYZ doctors, with our Sustho XYZ doctors, so that village people can easily consult with a city doctor through our patient point. So basically that is our main process of our startup. So you can say that this is the main heart of our startup, that we are actually setting up some patient point where a village people will get all kind of things, all kind of medical things, or any kind of doctor appointment he can easily access from that patient point. So village people don't need to use a smartphone always. So basically actually our motto was that modernizing rural healthcare system, so no village people will die any lack of treatment. So that was our main thing actually.
Can call it the panel discussion. So my first question is to Mr. Rafiq. You are saying that or when you started like low cost ambulance, right? So, and that was in the remote places in villages. So I think you have a very good experience in the village sector. You saw the real scenario. So why did you started that ambulance? Is there any lack of transportation there?
For example, in Bangladesh, the total population is 170 million people, and over 60% of the entire population live in rural area. But if you look at the ambulance, majority of the ambulances are in urban area. So what happens is when these rural people, they need to go to a medical facility in case of an emergency, they simply don't find an ambulance. Or even if they do, they have to wait many hours and charging many more than that ambulance actually cost. So the reason behind it, we figured out that the rural roads, those are narrower than comparing to the urban roads. So as a result, the big size ambulance, they cannot enter narrow village roads. Also, the usual ambulance that we see is very expensive. So we designed a tricycle ambulance, that's like auto, that's like tuk-tuk in Thailand. That can basically go anywhere in the village, and it's very low cost, and it's quite fast, because with the cost of just one usual ambulance, we could install 10 such mini vehicles. So I think in case of the need, of course, there is the need. And I believe many more such initiatives should be taken by, be it government, other organizations, or local organizations. For us, we changed it. I'm not saying the reason of it for some internal and business reasons. We had to change the business model into what we are doing now, is a telemedicine and digital health. By the way, our current model is also...
I think it's a role model for the very remote everywhere.
Sorry?
I think it's a innovative and it's a role model for the remote places where ambulance can't go, where the transportation is a problem. It's just not in Bangladesh. It's even in India. It's even in Kenya. Worldwide, it's possible, and it should be a role model.
Yep. We when doing that business, I've came across with a lot of people from Africa, from other part of Latin America where the situation is pretty much similar. But we found out that you don't have to be a big organization to start that. I think any young people or any students, they can just raise a couple of $1,000, cost $4,000 to $5,000, and then they can probably recruit one young guy from that locality who will be running that service. So it's an autopilot. That guy is getting a job, and the rural people, they are also getting the service. So it can be done autopilot. I think, of course, it can be a role model for many other people, individuals, government, and other organizations to start within their locality. We prove that, and we have the model with us. If anyone wants, we would love to share that.
So, from your experience, you were working in the villages with the tricycle ambulance. So, what is the most pressing health challenges that rural communities face, you have noticed?
So of course the one when it comes to emergency I've already explained, but other things is as I've said, it's the same situation. It's the demand versus the available resources. But you see, for the government or any other organizations, it's nearly impossible to build similar infrastructure in rural area that you have in urban area for many other reasons. So there will always be a lack of infrastructure in the rural area. But the blessing is technology, right? Now, let's say majority of the percent of time when you need to work, rural people need to see a doctor, they are not in brutal condition, they are not in dire condition. For example, OPD, outpatient department, there is one patient who is at the corner of the country, is traveling to capital of the country just to speak 10 minutes with a doctor. That's first consultation. That particular patient has to go through second, third, fourth, fifth consultations. What if we could simply automate the follow-up consultations via telemedicine? So let's say one guy from the corner of the country, he comes to Dhaka, see a doctor, or capital to see a doctor, or Delhi in India to see a doctor, and he goes home, and every month he just uses app or any other telemedicine providing services through this. I think Sustho, what Proloy has talked to us, is an amazing idea, right? They are using the existing infrastructure. There is a shopkeeper, he's selling medicines, so patients are coming to him anyway, right? So instead of coming to him and buying medicines, they can also talk to an expert doctor who is sitting in the capital. So I think in this era, the only way to solve this, or not the only way, the most quickest way to solve it is to get help from technology and to use telemedicines or other health tech services.
Thank you so much. So my next question is to Proloy Chandra. So I was asking, there is a huge socio-economic factor and difference between the urban area and the rural area, right?
Yeah.
So do you think for this the rural people are behind, or any other factor why the rural healthcare is still not improved?
Yes, actually, yes. Obviously, there is some difference between rural side and urban side, because when in our city, when we go to a specialized doctor, usually they take some fee from us, like 1,000 or 1,500 BDT, something like this. But that's the fact actually, because village people don't want to spend that kind of money for this rural sector, and that is true. So when I went to a campaign to a village of our country at Rajbari district, so they told me that no, we don't want to spend that much money for this doctor, so please give us some cheap doctor. They told me about it. So we did a thing that we set a weekly system actually. In a week, 4 to 5 days, we are using some MBBS fresher doctor for some consultation, and weekly 2 days we placing some specialized doctor from many hospitals. We actually already talked with almost 10 specialized doctors, and they really agreed about it, because they think that this is an amazing idea, and also they want to do some charity with us. So that's why they are taking less fee from our city side, as like they are taking only 100 BDT for the rural side actually, because they don't need to go to the village and they don't need to see them physically. They are just giving some, they are just giving some consultation between the video call. So yeah, obviously it's a big challenge for village people to spend this kind of money for their healthcare, but yeah, we actually solving like that. We are setting some MBBS fresher doctor to weekly 4 to 5 days, and we are setting up a weekly 2 days doctor who are specialized doctor in some department, as like medicine department, or you can say that eye specialized doctor, like that actually. So we are doing this kind of thing for solution the problem.
So you are talking about telemedicine can be a vital role to solve this problem, to gap this problem. So,
Yeah.
so for on that era, so what is the limited access the villager is still behind in case of telemedicine? Can this be solved up, or any government initiative should be done for this?
Yes, obviously. Actually, when we did some kind of campaign at those villages, we are facing a serious level problem, which is that internet issue. I told before that we are setting some Sustho patient point on the local pharmacy of those villages, but the fact is, in some villages, the internet speed is so much slow that they also pharmacy can't work on that internet speed actually. So yeah, obviously that is the big issue of our country, I think, and of rural area, the internet issue. And one more thing actually, that is that village people is so much influential, actually they always hear about the talk, or suppose some kind of influential people of the villages is like chairman or any kind of headmaster of a school. They are really influential. So if we can provoke those chairmen or the principal of that school, so they can easily, so village people will easily understand from them that how this is so important for them. So we are targeting actually those influential people who can help us for achieving this goal actually.
Yeah, I think the awareness is really important, and awareness should be built at home, on every home, and with influential people. So
Yes.
thank you, Proloy. Itumeleng, my next question is to you. So, health workers are working in the urban area and rural area, but the number, if we count the number, the amount on the urban side and the rural side is a huge difference. The people don't, the doctors, the nurses don't want to go to the remote areas, the villages, because it might be less pay, it might be less patients. What do you think?
I think, if I'm being honest, most of people, mostly, especially in my country, when I speak in the context of Lesotho, most of us come from rural areas. So we are born and bred in rural areas, and we see the struggle that happens in rural areas firsthand. Zero access to resources, lack of access to information, and everything like that. So people just have this mentality of, I want to make it out of the rural area, and then they eventually do, and they start living in the city. So, the city is like, in comparison to where we come from, is like the land of milk and honey, because there's jobs in the city, there's things to do in the city. So I think it's just the notion of wanting to make it out of the rural area so much, so that to a point where you're even equipped enough to solve the problems in your rural area. The fact that you notice the struggle firsthand, you still have this indoctrination of, I want to stay here, I want to stay here. It's not necessarily that people, I don't think it's the intention of saying we are leaving these people behind. It's just the fear of going back and then, end up being stuck at the back. I think it's it's just the indoctrination that people have due to the upbringing, honestly. So I think that applies to healthcare professionals, because at the end of the day, healthcare professionals are human beings before the healthcare professionals. So it's really very, very, very hard to break those deeply rooted paradigms where rural area is concerned, especially when your ambition or your goal throughout your whole life has been leaving the rural area to go to the
do you think
land
that
of milk and
the
honey.
doctors
Yes.
should be get incentivized?
Thank you. Yeah, definitely. I think they should. That's the only. I believe that's the only thing that could literally propel them to go to rural areas, because you need to understand that it's hard for people to actually live environments that are conducive or that provide everything that they need, to go to vulnerable places where they're gonna struggle with the sanitation, water, and everything, and they're gonna have to face the adversity and the plight of rural people firsthand. So it's very, very important that healthcare professionals get incentives, to do
my next question
a job
is to you.
of that
It's a very
magnitude,
common
because
question.
it's not
So
easy at all.
we go to doctors when we have faced the problem already. It's already crossed. But when it comes to mental health, the urban people are not going to the mental health specialist. How do you observe and what do you see that how the rural people take care about the mental health?
I'd like to speak about mental health as like a broad spectrum, as not only applicable to rural people or to city people. I'll definitely delve into rural people, but I noticed that mental health is very, very complicated. It's complicated in a sense that a lot of people actually have mental health issues, but they are not aware that they have mental health issues. So there's lack of awareness, first of all. You understand? So in like urban areas, the fact that we are exposed to information, like for example, I have like a podcast on Spotify where I speak about mental health through the lens of self-love. So it's mostly accessible to urban people. So urban people listen to my podcast and they're like, oh, so this is mental health. Oh, this is a mental health issue. This is a mental health issue. So rural people are not really, 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 really aware of that. They have struggles with like that. They have stress, for example. They could wake up and say, oh my gosh, I have stress. They just face lots and lots of adversities. They lose children, poverty. Like it's just a whole lot of adversities, and they get sick from mental health issues, but they are not aware that they have mental health issues. You understand where I'm coming from? So I think like mental health is very complicated.
Rafiq, Islam, so my next question is to you. You have worked and actually run a project about transportation in the villages, about that ambulance. So you saw the problems and the need of the speed going to the hospitals, right? So this project might not be working at all, but you say you are working on technology, mobile health apps, telemedicine. So you think telemedicine is enough to solve the rural health people, or we think doctors should go on the villages?
So of course it's not always enough. It's just an important part that can accelerate the process, right? Because telemedicine has a limitation. People who have less awareness or some sort of less exposure to the technology are also the people who believe less in technology. So typically, when we provide service, we see more urban people are believing in technology-oriented services than the rural part, because they want to feel the touch of a doctor. They want to see the doctor up front. So definitely telemedicine is not enough. There should also be doctors going there. I think government and other organizations are working on that. But you see, telemedicine is just a part of consultation. Healthcare is not just about this consultation. It's about medicine, authentic medicine and the supplies. It's about surgeries. It's about going and being admitted into a hospital. I think the entire process can be brought under technology. For example, for medicine and other supplies, people can use a service like us, Safewheel, and can order from anywhere in the country and their things delivered, because we have good e-commerce model right now and there are good delivery partners. And similarly, for the hospital, surgery, and other admission, all things can be done through technology. So if you want to go and get admitted to an ICU bed of a certain hospital, it's possible that you go into the hospital and then you discover that there is no vacancy. But if you could just simply decide when you're going out of your home, you just bring your app or whatever telemedicine provider you are using, and you could simply see which hospital has a vacancy of ICU. You could simply go there. You're saving your time. So I think it's about bringing entire manual healthcare system and connecting all these dots through technology. Maybe not possible by one organizations or by one company, but of course through partnership with other private NGOs and government organizations, we certainly will be able to design a healthcare system that is integrated and welcomes everyone and serves everyone, regardless of the geography.
You're saying that government and private partnership should be done on this area. So, do you think more voluntary work should be done on that area and more voluntary?
Yeah, so volunteering, of course, plays a significant role in development, right? So, of course, it should be done, but at the end of the day, it's also very important to, particularly, I think more private corporations should be going there, because statistically, in village, in rural part, there are more NGOs, government, of course, it's their part of the duty, and volunteers. But there are less private corporations going there because there's less money flow there, or maybe they simply cannot see the money flow. There are money, right? I'm saying about money since it's important for private companies. They just need to figure out how to go and serve these people because they're willing to spend. So the gap actually is about more private companies who are now very saturated in urban area, but there is an open market in the rural part. So I appreciate Sustho's work. It's a wonderful, it's a wonderful model. I think more and more young people, private companies like you guys should be coming and playing in the field.
Thank you. My next question is to Proloy Chandra. So Proloy, what do you think? How can we ensure essential medications on those areas so that people on village don't need to go to city side for some little tests or maybe some pharmacy healthcare checkups? Do you think that is possible on the villages, or still they should go to the city?
Okay, so actually this is a major problem because when a doctor will give some medical test to a village people, so how can the doctor can see the report? Yeah, this is a problem, but actually we almost solved it because right now a village patient can easily send his prescription and blood test report through the Sustho patient point. So actually we already developed a mobile application which is Android application which name is Sustho Agent. So our agent is using that application to use the consult with the doctor for the village people. So through that application we are actually creating a health profile and health record for a specific village people who is actually the patient of that doctor. So the patient can easily give his prescription or the blood test report to the pharmacy owner, and the pharmacy owner can easily send it to the city doctor. But the fact is, we can't send the X-ray report or ECG report because we need the scan system for that actually. So yeah, this is a problem for us. Right now, village people can easily send his urine test report or some blood test report easily to the city doctor. But right now, they can't send the ECG report or X-ray report or MRI report to
I
the
think the agent points
city
can
doctor.
do those
That's the problem we are
initial
facing
sample
right
collection.
now. But
So
yeah.
maybe they have lack of technology, but the agent points can collect the samples and set it down with the diagnosis centers and give the patient don't need to go to the city. So that's the answer, I think. So do you think any unique healthcare policy should be done for the old age people, because the young people can go to city very easily, but the problem is with the aged people? What policy or what system should be applied very quick for those people?
Oh, okay. Yeah, obviously, because when a old people like 70 or 75, they can't easily go to the diagnostic center, or they can't easily go to the nearest doctor's chamber or the government hospital. So actually, our idea is quite familiar with it, because the local pharmacy actually near the house of the villages. So aged people can easily go to that pharmacy and tell all the problem of him. So I think that will be not issue for us. Yes, obviously for the medical test purpose, he obviously needs to go to the diagnostic center, to the city side. So yeah, that is the travel problem for aged people. But yes, we can easily solve it if we can do something like that home test. But actually home test is quite popular in our city side, but it is not quite popular to the village side, and I think that no one is currently working on it. So we are thinking that if it is possible, that collect the sample from the village home and send that to the nearest diagnostic
Okay, that
center. Yes,
should be the
obviously it is
answer.
possible.
Thank you,
So we are
Proloy. We
currently
are
working
actually
searching on it.
very short time. So my next question to
Okay, okay.
Itumeleng. So Itumeleng, can you tell us uh, do you think schools in villages and the religious places they can help in this to build mental health awareness?
Thank you so much. I actually think so. No, actually, I don't think so. I know so they can definitely help. It's something that I haven't done, and I actually should be ashamed of myself because I've been planning to do it for a very long time. But I feel like, people like me that are already work in the area of mental health could actually visit schools in rural areas and talk about and teach students, or even if not students, or maybe talk about this mental health issues to discuss this mental health issues with teachers so that they can transfer information onto the children as well. And when it comes to churches, I feel like like a mantra that I go by, it's something that I read in Martin Luther King Jr.'s book. It says true leadership is born out of the experiences of the people. So I feel like Martin Luther King himself was a pastor, but he made sure to tailor his teachings in a way that aligns with the problems that people were dealing with at the time. So I think it's very, very important to actually have discussions with church pastors
So
to
we have a
go
question
beyond just
from the
what is in the
viewers
holy
actually.
book.
So I will ask to Mr. Rafiq Islam. You can also read it on the right tab. Let me read it for you. So, don't you think prioritizing the healthcare system is what has dragged us to where we are anymore disease outbreak? Less access to Medicare and failure of our public system of health. It has become a cooperation business where money is harvested and more people are suffering.
Well, I think that question particularly brought because I talked that there is money flow in the rural area. If it is the case, then the answer would be, you see, yes, I do agree that definitely more and more government and volunteer organizations should be working there. But what happens with these voluntary and government organizations is they have a certain timeline of the project, right? The project is done. Most of the time, it's either in autopilot, or let's say the government can change, or policy might change anytime, or they have to continuously give stimulus, pouring money in and in and in, and not any return. When private organizations go, what happens is they have a clear motivation of improving their service quality. Right? So I'm not saying that you have to go to the rural area and bring all the money from them with giving them bad service. No, what I'm saying is it's a good market. If you can give good service at affordable price, so you'll have more and more people taking your service. And by that money, you can either reinvest that, or you can improve the quality of the service. You can give the same service to the same people, but in a way better way, in a way better process. So that's what I mean, that whenever a private organizations are there, there has to be some sort of better service rather than when one or two companies are working. So for example, if monopoly, let's say if Safewheel provides telemedicine service in the rural part of the Bangladesh, and it's only Safewheel, then we can decide the service quality, right? We don't get any push. But if 10 other companies like Safewheel start providing the same service, then all these companies will be competing with each other to provide even better service. The ultimate winner is the people, is the populace of that particular village. So that's what I mean by the role of private organizations in improving the rural healthcare. Of course, NGOs and government are playing amazing roles. In my village, I can literally see when I was young, the amount of misconception of health and everything was there, versus now it's amazing. For example, 10 years ago, 15 years ago, even you'd not probably find a single person in my village, a single woman in my village who use sanitary pads. But now I can say at least 80 to 90% of them does that. The reason, of course, is the NGOs, the volunteer organizations, the governments. So they have an amazing goal and role in improving healthcare and changing the behavior of people, where private organizations can go and innovate things to improve that service.
Thank you so much. I think that goes to the answer. If anyone, if you have any more questions, you can write it down on the chat box. Itumeleng was disconnected, so my last question of the panel, it goes to Itumeleng. So you're hearing, right, Itumeleng?
Yeah, I can hear you perfectly.
So
thank you.
So no, we are talking about mental health, and it is very expensive, even in the city side, right? So and we have a huge income difference between the city people and the rural people. So what steps can be taken to address this shortage of mental health on the rural area? So how can what should be done on this case?
To cultivate mental health through the lens of self-love. So as I've already said in my speech earlier, the first thing that we need to do is to we are trying to make mental health resources available in rural areas through telemedicine, even though it's expensive. But in the meantime, while we're still working to make that accessible, it's important that, first of all, we teach rural people, we make them aware of mental health issues, and also make them understand the importance of finding solace within the communities. Because like I said, rural people, as much as they are marginalized and don't have access to a lot of resources, but they still have something that city people don't have, or that city people wish to have, is they live in close, tight-knit families where they can give each other love, be there for each other emotionally and mentally. So I think we need to remind them of the importance of actually being together, like holding each other close, loving each other, even though they don't have access to resources, but they
Thank you
can
so much.
find
This
healing
conversation is just getting more fruitful information
in
and
loving
ideas.
one another,
I
like
wish
embracing
we don't have any
one
time
another.
limits right now. So,
Thank you.
but before we finish this panel discussion, I just want to hear from all of you. What is your dream within next few years? What do you want to show that scenario that we discussed right now? So start with Proloy.
Yes, so actually, from my end, I think I want to establish to every village of our country a modernized rural healthcare system, which is our motto actually. So, I want to set almost 2000 Sustho patient point in different village of our country so that no one will die for the lack of any kind of treatment or lack of any kind of wrong treatment. There are many wrong treatment is happening in our villages right now, so really I want to stop it, and I want to set as much as Sustho patient point I can. That's it. That's for
Thank you so
that's
much.
actually my vision.
Same goes to Mr. Rafiq Islam.
I wish more and more people use technology to access healthcare services, and I wish not a single patient in my village at least doesn't suffer for this. So I wish more and more companies like Sustho comes and provide this service. Thank you, Tafsir. It has been a
Itumeleng.
Oh, thank you. Well, my dream is to become an international best-selling author. I'm actually in the process of editing my autobiography right now. So what I want to achieve, I was born as a marginalized person. My plight and adversity may not have been being born in a rural area where I was, I didn't have access to resources, access to information. But I really, really, really want, I want to cultivate self-love, self-worth, self-esteem to a point where people realize that them being marginalized or them not having access to resources does not deter them from attaining their dreams. Because even though I come from like I was born in a marginalized environment, I still have this big dream of being a global author, a global speaker. So I want to attain my dream so that I can show people that it's possible to attain your dreams irrespective of how unconducive
so
your
as we draw this insightful and
been.
inspiring discussion on rural health with a close, I am filled with gratitude or depth. I think all of our viewers and listeners are the same as well. So our time together has illuminated the challenges and the opportunity we draw over our discussion, and I hope everyone has a great understanding of the path ahead. So I think everyone has wonderful sessions, and as we move forward, let us not forget the stories we have heard today, the stories of individuals strive for better health and the arts, the stories of communities, the rural areas, and we all need to come together to support one another, and stories of the professionals who dedicate their lives serving those underserved regions, right? So I urge all of us to take insights and solution discussed were beyond this room. I want to express my deepest gratitude to all of our panelists. Thank you, Mr. Rafiq Islam, Proloy, Chandra, and Itumeleng, Likhama, and the organizers of Changemaker Summit. Let us continue this journey for the unwavering intervention and keep our dream more forward. Thank you so much.